Our patient is Mr. Velasquez. He is a 22-year-old who came here from Colombia. He speaks primarily Spanish with very little English. His diagnoses are schizophrenia and a mild intellectual disability. We gave him the occupational role history interview. His only occupation currently is sitting in his room masturbating, and his 14-year-old sister is currently in charge of his hygiene in the mornings. We also gave him the Allen Cognitive Level Screening, which he placed a 4 in. He does have violent tendencies in what he has spoken to us about. This should keep us from being alone with him initially and giving him his space. He also has language barriers, which mean we should be very careful about putting anything poison or toxic that he can't read, using a translator at all times, and being very specific with everything we say with him. He also has hygiene issues, which means we should help him wash his hands before each of our sessions and make sure to use sanitary wipes anytime we use anything with him. So we will be working mostly on personal hygiene and grooming. Our long-term goal is for him to consistently carry out a morning hygiene routine daily by the end of 2 months. Our first short-term goal will be having him brush his teeth with minimal assistance with 3 out of 4 sessions within 2 weeks. Our second short-term goal would be then to have him being able to brush his hair with minimal assistance, 3 out of 4 sessions within 2 weeks. Our first intervention will be to create a visual aid for brushing his teeth using pictures and paste on a board. Grading up would be using words only, and grading down would be to have them pre-cut and numbered for him to paste. Our second intervention would be an ordering game for showering, where he would have to put pieces and pictures on a board in order. Our grading up would be using words only, no pictures, and grading down would be pre-numbering them, so all he has to do is put them in order. The third will be to create a checklist for his morning routine. This will involve using pictures and naming. Grading up would be to, again, using only words and no pictures. Grading down will be to pre-sort them and pre-name them so that he only has to put them onto the checklist. Our fourth will be a mock morning routine using props and verbal cues. Grading up would remove the verbal cues, and grading down would be adding those visual aids that we have already created for him in prior interventions. After this, we will have him take the cognitive performance test to see his ability in being able to take care of himself.